The country continuing to move in the wrong direction, adding nearly 67,000 new coronavirus cases on Monday and hospitalizations nationwide at the highest level since mid-August.
I think we're right now at the cusp of what's going to be exponential spread in parts of the country.
Dr. Anthony Fauci underscoring that the country never fully emerged from the first wave.
Till now, we're at the highest baseline we've ever been, which is really quite precarious. So, you know, it's kind of semantics. You want to call it the third wave or an extended first wave. No matter how you look at it, it's not good news.
In El Paso, Texas, a hospital under severe strain, a spokesperson for the University Medical Center of El Paso tells CNN, quote, "We're at the highest point we've ever been." Tents have been set up outside the hospital to assist further coronavirus patients with less severe cases, and non-COVID-19 patients are volunteering to be airlifted to other parts of the state for treatment.
The increase in the number of COVID positives was much higher, obviously, than expected, but nonetheless, the area hospitals, along with ourselves, have added approximately 250 additional beds.
In Idaho, more people are currently in the hospital with coronavirus than at any other point in the pandemic. The governor rolling back the state's reopening plans, which includes limiting the size of gatherings, but not instituting a statewide mask mandate despite the surge. In Colorado, more than 2,200 new cases were reported Monday, the state's highest level since the pandemic started. The city of Denver warning another stay-at-home order may be necessary. Colorado currently has a statewide mask mandate. It's set to expire in a couple of weeks. The governor hasn't yet decided whether to extend that order.
There's a public health order that we issued that limits social gatherings to 10 people or less, and very critically, no more than 2 households. So if people do feel the need to socialize, we totally understand that, but not a neighborhood block party.
In the Northeast, New Jersey seeing a rise in new cases. In Newark, non-essential businesses will be closing by 8 p.m. for the next 2 weeks, starting today.
And we need to stop the rise of the curve and push these numbers back down. And folks, only we can do it together.
Even with a second coronavirus outbreak at the White House, President Trump held a swear-in Amy Coney Barrett to the Supreme Court. While guests were more socially distanced and required to wear masks, the event looked similar to the September superspreader gathering in the Rose Garden, after which the president and at least a dozen others in attendance tested positive. Missing from the night, Vice President Mike Pence, who still traveled to Minnesota for a crowded rally Monday, just days after multiple members of his team reportedly tested positive for coronavirus. The president's Supreme Court celebration the same day as his 3-stop tour across Pennsylvania. Trump using campaign rallies without social distancing and few masks to continue to lie about the pandemic beginning to ease as the country sees the most new cases in any week.
We're rounding the turn. You know, all they want to talk about is COVID. By the way, on November 4th, you won't be hearing so much about it. COVID, COVID, COVID.
Also in Pennsylvania, former Vice President Joe Biden making an unannounced stop and condemning Trump's handling of the coronavirus crisis.
The bottom line is Donald Trump is the worst possible president, the worst possible person to try to lead us through this pandemic. And I don't think he just either doesn't have any idea what to do or he just doesn't care.
As the Trump campaign plans to visit states like Michigan and Arizona this week, Biden announced he'll be on the road too, splitting the map with his running mate Kamala Harris to cover more ground in battleground states and beyond.
We're going to be traveling, continue to travel, but the big difference between us and the reason why it looks like we're not traveling, we're not putting on super spreaders. We are doing what we're doing here. Everybody's wearing a mask and trying as best we can to be socially distanced.
Former President Barack Obama will campaign in Florida for the second time in 4 days later today in support of Biden, who will be in Georgia for his own event, expected to make a closing pitch for national unity.
You know me. I am not overconfident about anything. I just want to make sure we can earn every vote possible. That blue wall is has to be reestablished.
Let's bring in Dr. Jay Varkey, Associate Professor of Medicine at Emory University in Atlanta. Dr. Varkey, I just got to start with the kind of what can we do, what should we be doing as a country right now to get a handle on this? I mean, the folks have been, like you, have been warning about this for some time. Here we are, right? And we're still nationally debating the science. I mean, 8 months in. I mean, what are we going to do about it?
Jim, I think the first thing is we need to be honest with the American people. I mean, I know people want optimism, but optimism breeds complacency. So I think, not to fearmonger, but as an infectious diseases doctor, what I would say to your viewers is that we need to talk like adults and speak some hard truths. In terms of what we need to do is we need to trust the science. The reality is we can get through this. Infection is not inevitable. Remember, we have multiple studies to show that as few as 20% of people may be contributing to 80% of infection transmission. So if we trust the science, if we wear a mask, if we avoid crowds in closed indoor spaces, especially if there's talking, shouting, or singing. So specifically, if we keep out of bars, dine-in restaurants, political rallies, and also avoid the type of settings that are propagating this current outbreak, which really seems to be family gatherings of friends and extended family outside of the household, we can turn this around the same way we did this spring, the same way we did in the summer.
What is going on with children? The fact that the American Academy of Pediatrics says you've got this 11% rise in cases among kids. Almost 800,000 kids have contracted COVID since the start. We just heard from a young woman named Maggie. I don't want to alarm people, so sometimes I hesitate to even ask these questions, but I think the numbers are unavoidable at this point. Is it because kids are back in school, or is something else at play here?
Poppy, the exact driver isn't entirely clear, but I think that speaking the facts is the important point. Again, we've repeatedly heard the president claim that children are immune to COVID-19. We know that that's incorrect, that is a lie. As you said, the American Academy of Pediatrics has described over 800,000 children in the United States who have contracted COVID-19, including 100,000 in the last 2 weeks alone. And it is important to reassure parents like the three of us that thankfully, most children who develop COVID-19 do not develop serious complications. They don't develop serious complications like death, although some have. And again, my heart goes out to those families. But I think the most important thing we need to recognize is that, and probably the best way to actually keep our children safe is to limit indoor gatherings only to those that are in our household.
Dr. Varkey, do these rises in numbers among children change your view of school reopening? Dr. Fauci and others, including on this broadcast, have said, listen, in low infection rate areas, so-called green zones, even yellow zones, it's safe for schools to reopen. As you're seeing this uptick, does it change your view?
I think it impresses on the reason why we in our communities have to get control of transmission. So sure, you can actually I think that we have enough anecdotal experience that you can reasonably safely start in-person school, even when there's some degree of community transmission. But when cases are skyrocketing and when we don't have control, that increases the risk. The reality of it is that I think that we have a model of how we've actually run hospitals safely, going back all the way to March, that can serve as a example of how we actually do in-school safely. But the key is we have got to come together as a community and drive down community transmission.
Yep, and it takes steps by all of us. Dr. Jay Varkey, always good to have you on. We appreciate it.